Most individuals are diagnosed incidentally. They have a blood count done for some reason, and an elevated white count is noticed, or specifically the lymphocytes are increased, one of the white cells. And at some point, one of the doctors decides to look into that further and sends a test. We call that a flow cytometry test, and the diagnosis is established. So that's the usual way. That doesn't require a bone marrow biopsy, usually doesn't require a lymph node biopsy. And then, of course, for most individuals who don't have symptoms, no treatment is needed at first. So that's often confusing, of course. You've been told you have leukemia, you have a cancer, and then you've been told that you don't need treatment. So we see a lot of patients who want to hear more about that, and so we explain the reason for that, and that's historically early treatment didn't change the course of the disease. Now the problem with that is that those treatments weren't particularly effective, and I think we're moving into an era where that may change. And so you're already seeing some interest in so-called early intervention trials, where individuals who don't typically receive treatment are now entering clinical trials and studying whether treatment with some of our newer agents will change the course of their disease. So we still, though, have to be very conservative. We still think watch and wait, or as patients say, watch and worry, is most appropriate. But again, if there's questions about that, it's worth asking about clinical trials, because I think we'll see some advances in this area as well.